Hey, joining the conversation, Dr. David Klein of the Stages of Life Institute. We love it when the doctor's here. We always learn, and so many of the things we learn, we've never had the chance to hear before. All of them aim toward our better health and usually saving us a lot of money. All right, one of the things that we hear repeated over and over and over again, whether it be a food commercial, a vitamin commercial, a nutraceutical commercial, is antioxidants. How many in the audience, by a show of hands, know what an antioxidant really is? No hands. Doc, nobody knows.
Well, go figure that one out. Okay, so what's an antioxidant? Why do you care? Why is it important to you? Important questions, each. But the most important question is, what's an oxidant? Before you're against something, before you're looking at something that fights against something, you really ought to know what it is. So an oxidant is it's a chemical, it's an agent, it's a molecule that will cause a reduction of a particular other compound. Marvelous. That takes you back to high school chemistry. But really, what it is in terms of why do you care? Oxygen is necessary for life. Oxygen concentration. How much oxygen is in the air right now? 21%. Okay, very, very little variation even as you go to high altitude. 21% oxygen. When it gets much below 18%, you start getting a little dizzy, or most people do. When it goes above 30%, it starts to cause damage to the lungs. Too much oxygen, death. Too little, death. It's all about balance. Well, guess what? Okay, when oxygen hits the lungs, when oxygen hits the bloodstream, it's not all joy and rapture. Okay, sometimes it'll generate something called singlet oxygen, ozone, and other agents that actually cause tissue damage by either damaging the cell membranes or it can do genetic damage, does chemical damage in the liver. But each tissue in your body sees oxygen differently. Each one sees these antioxidant needs very, very differently. The most important tissue is perhaps the lungs. Why? Because the lungs are exposed to the highest oxygen concentration anywhere in the body. End of discussion. And so as the lung tissues age, and as something happens to it rather dramatically, like radiation therapy, like chemotherapy, like medications that you might receive for rheumatoid arthritis, which, by the way, is also possibly a chemo agent, it damages or destroys the body's capability of producing a particular antioxidant called superoxide dismutase, which is an enzyme. Okay, very, very important. And when it goes away, you're at risk for developing emphysema, and pulmonary fibrosis is very, very important sort of a thing. So how do you protect yourself, lung tissue in particular, from these oxidative moieties? Okay, well, it's not going to do you nearly enough good to go out there and buy coenzyme Q10, resveratrol, and many of these other ones that are being marketed at relatively high expense for very little benefit. Why? Because neither one of those works on the lungs anyway. That's the place where most of this damage occurs. Has to be lung specific. So what do? Okay, if you're interested in taking care of the lungs, N-acetylcysteine, marvelous antioxidant, works the lungs. It does a bunch of other things that we'll discuss in different shows. Glutathione orally, very, very beneficial with regards to treating, preventing, and forestalling the damage from chemotherapy and radiation therapy. High-dose folic acid. So if, in fact, you're going to be going through chemo, radiation, if you've recently gone through radiation or chemo, or if you're expecting to, it's a good idea to load up on these things, and they're dirt cheap. Oddly enough, you do not need to spend a lot of money for any of this stuff. And the joke is that they do other beneficial things as well, not just as antioxidants. It's very, very interesting how this works. Where else do we need antioxidants? You're going to look at the skin. Okay, well, the skin's very interesting. When you're using antioxidants in the skin, you want to go transdermally. So you can take these oral medications, they'll do very, very little good. Topical MSM is probably the single most potent and single least, but it's the best economic value you can get with regards to a dermatologic antioxidant. We use this one called Kinkies. When we choose to charge more, we call it Fractalane because it's marvelous when you're doing laser surgery on the skin. We get to charge more because it's got a fancier name. But Kinkies, nevertheless, and you apply it topically and it works beautifully. What about the liver? Liver's kind of an important place for antioxidants. Why is that? Because as the liver is detoxifying other things, it generates lots and lots of these oxidative moieties, singlet oxygen in particular. It's kind of an interesting sort of a thing. Superoxide dismutase is important in the liver also, but it's a whole lot less expensive to get back to what? N-acetylcysteine, for God's sake. You're talking $15, $18 a month instead of having to spend $50 to $60. And again, recognize the fact that coenzyme Q10 hasn't really appeared yet now, has it?
Nope.
They're out there hawking the heck out of this stuff. It's the single most expensive way to treat this. What else do you get? Alpha-lipoic acid. Now, why in the world would alpha-lipoic acid, which, by the way, is the most potent of all antioxidants, very, very useful if you have diabetes. Oddly enough, diabetic polyneuropathy responds nicely to alpha-lipoic acid, as it does for the eye if you have macular degeneration, far more so than resveratrol or lutein, lycopene or the rest. Your best value is an alpha-lipoic acid, which is very, very inexpensive. So, we cobble together these antioxidant mixtures, mostly when people are lazy. I would much rather people buy them individually so that you can titrate them out, but some folks don't like to think too hard about it, so they buy the mixtures. Whatever you do not overspend for these medications, and they are medications, because they don't cost. They shouldn't cost a great deal of money. Now let's look at the kidneys. I've got people out there, patients out there, that were destined for, dialysis. Why? Because the kidneys operate in a very, very low oxygen tension environment. It's a highly toxic area of the body, and they tend to die off with age. So what can you do to protect your kidneys as an antioxidant? Let's get back to coenzyme Q10. Forget it. Let's get back to resveratrol. Forget it. Okay, what do you use? Taurine. Taurine is an amino acid. It is a marvelous antioxidant for the kidneys. And again, when combined with high-dose folic acid, we've seen restoration in kidney function in folks that were destined to go on the machine.
Wow.
And it's very, very interesting. You get pre and post values on these folks for as little as $9 a month. You are talking like seriously no money here to protect those two beans that are sitting in your retroperitoneum that are keeping you let's say, free from having to be high-tech, the $5 million man, whatever you plan to call yourself after you're hooked up to plastic, pumped through this thing, and spending a couple hours a day looking at your nails. So antioxidants are a matter of choice. Okay, what is an antioxidant? It's something that protects you from the ravages of our environment. Okay, the oxygen around you is necessary for your life, but it's also slowly killing you. That is the take-home message here.
When you're talking about 21% oxygen, immediately my mind went to, how do they figure out on an airplane or something that's being pressurized, or a submarine, or the space station, or even scuba tanks, that you're getting the right amount of oxygen?
Well, that's why you pay them the big bucks to fill those tanks up. Yeah, the guys with a high school education and may not even speak in incoherent sentences. Well, when you compress air, okay, it's going in at 21%, it comes out at 21%. Okay. You really can't damage that. The place where you get into trouble with scuba is with heliox, okay, is when you start blending things out there for deeper dives or longer dives. Or let's say you're going into a compression chamber, and we did a lot of that at Duke. Then you start changing the oxygen tensions. But when you're in a submarine, when you're in a compression chamber, you can check the oxygen tension by simply measuring it. You have ambient oxygen tension meters. We check this actually when we administer oxygen all the time. When I was still doing anesthesia, that was one of the things that we did as the gases were administered to you, is that the oxygen tension was measured to prevent mishap. I mean, the last thing you'd want to do would be to give somebody the wrong gases and asphyxiate them. Not that it's never happened. Okay, it has happened. But one of the safeguards in anesthesia is a little FiO2 monitor. It's something that you keep handy in what they call the circuit to make sure that you're not asphyxiating somebody as you're trying to save them surgically.
So I could get in my car, or I could go online, and I could follow Robin's advice, and I could make my way online or in person to the stages of life and get directions on what antioxidants I need.
That is very true. So come on into the office. Our office hours are Monday through Thursday, 8 to 5, and we're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. Our phone number is 407-679-3337, and our website is stagesoflife.net.